Considering surgery for spinal stenosis is really important. Once you have surgery, there is no going back. And I've seen many patients do well with surgery, and other patients wish they knew some information going into surgery. And today I want to review with you 5 considerations that you should make prior to having surgery for spinal stenosis. It can be a very effective surgery, but I think knowing these things is really important. And the great news is, with the things I'm going to go over with you, these 5 considerations, they're modifiable, and that you can change some of them to help you make a more informed decision or make you have a better recovery experience. And so I want to go over those 5 things with you today. I'm excited to do it. My name is Dr. Michael Derry. I'm the owner of Revision Health Services here in Jacksonville, Florida, and I've been a physical therapist for nearly a decade, and I love treating spine. It's what I do all the time. And these 5 things that I have really found to make a difference in people's recovery and experience of spinal stenosis surgery are important to consider before you have surgery. And I just want to help you make a more informed decision and give your body the best chance possible to the recovery that you want. Let's go over those 5 things right now. So the 5 things that I would be considering after years of treating patients if I had spinal stenosis and I was considering surgery would be: 1, do I actually have spinal stenosis? 2, where do injections play in that? And I think that's important to consider when you're going to have a good recovery with spinal stenosis surgery. 3, what are the things that you need to be doing pre and post surgery? Like, how do you stack as many cards in your favor as you can? 4, what are the risk factors? So what I mean by that is, what are you at risk for in the future? And then 5, one surprising tidbit that if you do have surgery, you can expect to feel this right away. Do you actually have spinal stenosis? I think that's considering, if you're watching this video, you've been told you have spinal stenosis. And if we take a 15,000-foot view of spinal stenosis, its true definition is a reduction of space. You're just losing space, and you have an intolerance to extension or the closing down of the spine that challenges the space of the spine, and you have leg pain. And so you've probably had a diagnostic image, such as an X-ray or an MRI, to show, hey, you do have spinal stenosis. It is some sort of bony change or arthritis is encroaching around the nerve, causing you to have nerve pain down your leg. And so those are common things that people tell me and that we see in the literature to diagnose spinal stenosis from an image. But what we care about is what you feel like and are looking like in the day when you try to do your daily activities, because there's a lot of people who have spinal stenosis because it's just a definition of reduction of space without any symptoms, and so they don't get surgery for it. But the people who have surgery are the ones that I see in front of me when I'm treating them in their house or going to their gym or wherever, is that they have an intolerance to extension. They can't stand up tall, and that when they walk, they have a development of leg pain as well. It's called neurogenic claudication. And my next question that I always ask them is, when you go to the grocery store, do you use the cart to lean on to give you that little bit of support, and does that help your leg pain? And when patients check those boxes for me, I know that they're going to respond well to surgery if they need it. But of course, we do conservative care first, because that's what the literature shows. And I've seen people respond very well to physical therapy and other conservative measures without having surgery, even if they have the nerve pain and leg pain down their leg. And so I think those things are worth considering. And so when I ask you if you truly have spinal stenosis, well, you may have it on an image, but do you have it diagnostically, functionally? Can we reproduce it in the exam? And is it something that's actually limiting your daily life? We want to make sure we're checking those boxes before we have surgery, so we can know that that surgery is the most appropriate option for you. I hope that makes sense, but when you think of spinal stenosis and you truly dive into the literature, spinal stenosis is a functional diagnosis, and that it needs to be limiting something in your day, and you need to have the signs and symptoms associated with spinal stenosis, which are, what are we seeing on image, and what do we see that you're feeling in front of us and that you're reporting is the most limiting thing in your back and leg pain. I hope that makes sense, but that's the first thing that I would consider if I was going to have spinal stenosis surgery is, do I actually have spinal stenosis, and do I feel confident in that diagnosis? The other aspect I want to talk about is the second thing, which is injections. And so some people are a little shy of injections, and people who end up having surgery for spinal stenosis typically have an injection beforehand, but it's not necessarily a treatment diagnosis, it's more of a diagnostic injection. And so what they do is I have seen they use an ultrasound, and they go in and they inject some sort of analgesic around the nerve where they think the symptoms are coming from based off of your functional exam, right? So we use the functional exam, figure out, okay, if you're having leg pain in your calf and your toes, that's a different nerve than leg pain, like let's say that just goes down your hamstring. And so using what you're feeling combined with what we see on the image, it can help be more precise with that injection. They do the injection, and what they would expect is maybe not so much improvement in the back pain, but immediate improvement in the leg pain. And the leg pain is important because that's the number one thing that people want to improve when they have spinal stenosis surgery. In that if the injection helps the leg pain, you can be more sure that that surgery is going to be a good option for you. And by more sure, I mean, I've seen people have the surgery, they have significant leg pain going in, they have the surgery, they go to stand up for the very first time and the leg pain is better because they knew that they were absolutely sure that that nerve was getting a little bit of inflammation around it, a little bit sticky, causing some of that leg pain when they walk. And so when you consider that the injection may be really, really helpful to help be diagnostic, it's worth doing prior because it's relatively low risk compared to the surgery, and that if you check that box, you end up doing better afterwards. And so I've seen so many patients that were very, very encouraged with their recovery because they had that diagnostic injection, they had relief when they did the injection, and that they feel more confident that their pain is coming from the spinal stenosis in their back. Again, back pain can be tricky. You just want to be sure that that's what's causing your discomfort before you go under the scalpel. So that's the second thing I would consider. Let's move on to the third thing. Let's have some more fun. All right, guys, this is the third and probably the most important thing, but this is your body that we're talking about. So you want to consider what you're doing prior to surgery and what you're doing after the surgery. And so when you do the surgery, most common surgical procedure is a laminectomy, in that they just remove a little bit of the bone around the nerve, and then they tell you to go to PT or not go PT. I think there's some people that say not to, and I firmly don't believe that. But this is your body that we're talking about. And so to make the most informed decision going into surgery, you really should be teaming up with a movement specialist that's going to help you after surgery, help you achieve your goals. I think it's very important to shop around and go into a clinic or do a concierge PT like myself, or go somewhere where you trust and you know that that physical therapist or movement professional is going to help you not only make the best decision for your body, but help you recover after as well, because everybody's goals are different, everybody's body is different. And just because the surgery is there to help with your leg pain, most of the time the neuro symptoms, right, that sharp burning pain down the leg, it does help with that, but it isn't going to take away years of back pain right away. It's not going to take away years of not being able to exercise or better your body. So the more strength and lean muscle mass you can put on prior to surgery, the better off you're going to be afterwards. I've seen this so many times, and no one's ever regretted doing a few 4, 6, 8 weeks of PT prior to better their health and body. And even those exercises are going to be limited, and the things that you can do are going to be limited and maybe a little uncomfortable. We know you're not doing damage, and so you want to use that time frame to prep and know that after surgery you're just bettering your health. And so you're going to be doing some cardiovascular work, you're going to be doing some core strengthening, you want to be doing some hip strengthening. You want to challenge your body, improve the muscles in your back and your hips, because when you're feeling better after surgery, you literally want to hit the ground running so you can have the best outcome possible. I can't stress this enough, but your pre and post habits are going to be very important. Years of back pain isn't going to go away immediately. You're still going to have to put in some work. And so do that work beforehand so your recovery and your experience afterwards is just that much better. So consider how you're treating your body, put your team together prior, utilize that team to better your health before surgery, and then go back to that team right after surgery so you can make sure that you're having the outcome you want and the outcome that you deserve. Whew, guys, that's a I'm very passionate about that aspect, but people don't take advantage of that enough. I know it's investment of your time and resources, but trust me, it's well worth it. So the fourth thing I would be considering for spinal stenosis surgery, and I think this one is definitely worth considering, is that statistically speaking, you are putting yourself at risk for more likelihood of having surgery in the future. And so let me give you an example. I've seen clients before that have had a 1-level laminectomy, L4, L5, and that a few years later they end up having L5S1, and then a few years later maybe they have L2, L3. And so you start removing bone, and that bone is there for something, right? And so it helps you move forward and backward. I'm saying that because that's where the lamina is, so it helps restrict. And so that bone is helping you move. And so that movement is important, and you'll regain that movement after surgery, but just know you are statistically increasing your chance to having surgery again. And so, it just circles back around, is that you want to make sure that you're making an informed decision for your body, and that this is the best decision for your body, because I'm not saying you will have more surgeries in the future. I'm just saying you are statistically more likely to have more surgeries in the future. So it's worth knowing that going back or before going into surgery. And those future surgeries often include laminectomies and more removal of bone and things encroaching around the nerve, and eventually a fusion. And so we don't want to be having those things unless we need to. it's worth considering, is this the best decision for me? Because we definitely don't want to be having those surgeries unless we don't need them, or unless we need them. And so I just always emphasize, okay, you are more likely, but that doesn't mean it's going to be your story, but it's my job to make sure that you're making an informed decision for your body now. Now that we've covered something a little more doom and gloom, let's review what the fifth consideration would be, is that after surgery, you're going to be feeling a lot better. Let me explain why. So the fifth thing I would consider, and let me just paint a perfect picture for you here. So let's say you're considering spinal stenosis surgery, you have the neurogenic claudication, and that when you walk, you have the leg pain, and that you've had the diagnostic injection and the therapeutic injection to help say, okay, if we put some anti-inflammatory around the nerve, it actually improves your leg pain, and you're able to stand and walk longer. That's amazing. And when you check those boxes and you're doing the PT and bettering your health prior, and you know your risks going into surgery, and you finally have surgery, what can you expect on day one of that recovery? And that in 90% of my patients who fit those categories beforehand, and that we know that they're appropriate for the surgery, is that when they are in the hospital or in the outpatient clinic and they get up for their very first time, their leg pain is significantly better. And that's amazing, and that's such a good feeling. And when I talk to that client the day one or day two after their day one, day two post-op, they're doing so much better, and they're just so happy with their decision. And then they're surprised by the very last thing that we need to consider, is that if you do have surgery, you will be walking day one, that you will be getting up and walking. They're removing a very small portion of the bone with a laminectomy, and then it's perfectly safe to get up and start walking immediately, because that is the biggest thing that people have problems with, and that in that sense, such as just a relatively minor surgery, you can get up and you can get moving right away. So you're going to get up, you're going to be on a walking program. Your physical therapist is going to help you through that protocol. You're going to walk your way into your favorite physical therapist and start your surgery, or start your recovery journey. And so people are usually surprised in that they're walking and standing and doing a lot more than they think they would be doing because they had spinal surgery. Not all spine surgeries are scary, and so you'd be very surprised in that I see clients very enlightened and very looking forward to the recovery, because day one they're able to stand up and get walking. And then I tell them, hey, you need to be walking 10-15 minutes every couple hours just so you can keep your body moving, get those muscles around your spine strengthening again, and just getting ready for what the future holds for you. And so many people are very surprised that they can just walk and walk and walk, and they're not going to damage or hurt their spine after the surgery. It's just really cool to see, and it's amazing to see where the technology has come and the surgical interventions. But it's one of those surgeries that if you are appropriate for it, people do very, very well. And so I hope you guys enjoyed the video today, because we reviewed 5 things that I would definitely be considering if I was having spinal stenosis surgery. It's not a super scary thing, but you just want to be making sure that you're making the right decision for your body now and later. So guys, thanks for hanging around. My name is Dr. Michael Derry. I'm a concierge PT here in Jacksonville, Florida, and I'm a spine specialist, and I love talking about this. So if you guys could give the channel some love and show us some support, I would greatly appreciate that. But guys, as always, stay healthy, keep moving, and take care of yourself.